I'd like to talk about the science of inflammation. Unfortunately, a lot of people have inflammation. They go to the doctor, they get put on a certain medication, and that's pretty much it. But they're covering up the root cause. Dealing with inflammation goes way beyond just taking some fish oils. And I've been very lucky to be in practice for over 30 years to really see the underlying root causes of inflammation, because some of these causes are not in the medical literature. Inflammation is an immune reaction. It's not just about treating a pathogen or some virus or bacteria. The problem is when inflammation goes on too long, that's when we get all sorts of problems like cancer. Cancer tends to invade areas of inflammation. And anytime we have inflammation, we also have a lack of oxygen. And both inflammation and hypoxia causes cancer to grow more aggressively. Let's start with the first one, fibromyalgia, which is inflammation that spreads throughout the entire body. Now, one time when I was in practice, I reached out to my patients to find out who had fibromyalgia. 100% of all of these patients had fibromyalgia only on the right side of the body. As I was digging in further, I found out that they all had problems underneath the right rib cage. That's where you have the little tubes that are called bile ducts. And sometimes the bile that's supposed to flow from the liver into the gallbladder becomes thickened, and it can create a backup of bile into the liver, and that bile is like a detergent. It can irritate the liver, and it can cause pain that radiates up into the right shoulder, up into the neck, from something called bile sludge. I did something very interesting. I had them massage underneath the right rib cage, and just to hold that pressure for about a minute. And then I would reevaluate the pain, and it was like it went down to almost zero. I put them all on a remedy of taking bile salts with their food and also on an empty stomach. One type of bile salt is called TUDCA, and that just kind of really opens up that flow, and a person can see huge results very quickly. If someone has fibromyalgia through the entire body, it's usually not coming from the gallbladder. It's usually coming from a virus that has come out of remission. Epstein-Barr virus is shingles. Another one is the herpes viruses. And all those viruses come out when your immune system is weak. What happens with stress is it activates cortisol, and cortisol suppresses the immune system. The next thing that can cause pain is Lyme disease. Lyme can create a lot of inflammation in your body. It downgrades your ability to use vitamin D. Vitamin D, hands down, is the most important vitamin for your immune system. And vitamin D does two things. It'll increase the immune system or bring down the immune system if your immune system is overactive. So it's the ultimate solution for both problems. Next one is old injuries. As you age, you get things like arthritis, stiffness. I am the poster child of old injuries. I broke my left elbow in 30 places, my left shoulder. I broke my neck. Other than that, I did pretty good. You're gonna have to constantly work on stretching, not just your ligaments and muscles, but something more important, and that's called your fascia. My worst enemy and your worst enemy, if you have this, is being sedentary. You have to keep moving, keep stretching. Next one is inflammatory onchotaxis. That is a situation where cancer spreads into areas of inflammation. For example, if you are a smoker, you'll have inflammation in the lungs from damage. Cancer will spread into that area a lot easier. I will get to some really powerful strategies in a minute. Next one is food allergies. If you're eating something that is irritating your colon, whether it's gluten or a peanut or soy, you're going to get constant inflammation. This is basically the gut-brain axis. Whatever's going down here, it's going to affect up here, like grains, especially wheat. Pretty wild how whole grains are really promoted as a health food, and we should eat more of them. Not if we don't want gut inflammation. When you have leaky gut or bleeding gums, what happens is certain microbes can get into the body, go into the bloodstream, and create a lot of problems. One of the things that can create gingivitis is a severe vitamin C deficiency because you're eating too much sugar or carbs, and then you start getting a breakdown in the collagen. The microbes are there to help build up this mucus layer to kind of create a barrier. If those microbes are missing because you took an antibiotic, now we don't have that protective layer, and now we have an imbalance between the good bacteria and the bad bacteria. We get an overgrowth, and then we have all sorts of issues with the gut. Next one involves cortisol. People that have high levels of cortisol have a lot of inflammation because they have developed something called cortisol resistance, where you have too much of a certain hormone, and then all of a sudden the receptors don't work anymore. Now we have the opposite effect. If cortisol is an anti-inflammatory, now we just get more inflammation. Another big one is just consuming junk food. I'm really talking about sugar, and I'm not talking about just regular sugar. I'm talking about the junky, industrial, synthetic sugars. And then we have something else, which is interesting. It's a hidden sugar. It's actually a starch, modified corn starch, modified food starch, maltodextrin. And an average person consumes over 150 pounds of this stuff every single year. It'll spike your blood sugar super high and it will keep you inflamed. I said sugar, starch, and seed oils. It's the worst of the worst. These seed oils are fats that don't really provide energy. There's a cell right here. These seed oils get locked into the membranes and they affect the function of the cell. It's very hard to get these seed oils out of the body. If you stop eating them, it'll probably take a year and a half to completely get them out of the system, and I highly recommend you do that. And an average person consumes between 5 and 8 gallons every single year. Next one is having too much visceral fat. That's the fat around the organs. If you consume too much sugar, starch, or seed oil, is you start developing insulin resistance. Insulin is not going in the fat cell. All that fat now is stored outside the fat cell. And that's all the fat in your liver, around your organs. Next one, autoimmune diseases are even more common than heart disease and cancer. Normally, you have certain T cells, it's part of the immune system, to prevent that from happening. And when that cell becomes diminished or dysfunctional, a person will develop an autoimmune disease. We have an overreactive immune system. Another one is soy protein isolates. It's in protein powders, fake meats, and even certain diets. And then you're going to use that as a protein to help your body. I know people that came into my practice consuming a lot of that protein, and a large percentage of them came in with a lot of inflammation around the liver. I took them off that product and it cleared up. Next one is EMF, electromagnetic fields. If you do a lot of talking like this, you're going to get a lot of electromagnetic fields into your brain that can create inflammation. I had someone come in my house and scan the entire house for EMF radiation. At the time, I had palpitations and I was trying every nutritional remedy, and I also had insomnia. As soon as this individual came close to scanning around my bed, the meter just went off the chart. It just started buzzing like zzz. It was behind the headboard in the wall where my bed was. And there were wires that were crossed, creating a magnetic field that extended 8 feet from the wall. I was literally being bathed in a magnet. As soon as we fixed that, all my palpitations completely went away and I started sleeping like a baby. Next one, certain medications, they'll guarantee you're going to have more inflammation as a side effect. That will lead to a problem and that'll be treated with another medication, and it just keeps going. There are people that I know on 15 different drugs, 20 different drugs. And I'll guarantee some of the side effects from one drug is being treated by another drug. Their body's in a massive confusion. I recommend finding a good doctor to see what actual medications you absolutely need to take. And I would also ask them to help you wean off certain medications that you could potentially find another remedy to treat it for, like a natural remedy. Next item to talk about is too much iron. Iron is very inflammatory to the point where you could develop cirrhosis of the liver just from having too much iron. Never take iron in a supplement. If you donate blood and you feel better, then you know you have an iron problem. One antidote is to increase your copper, which actually allows the iron to be more protected. Next one, if you have a fibroid, that can refer a lot of pain to the back. Well, one simple remedy is to up your vitamin D to 30,000 IUs every single day. Next one really important clue for heart is if you exercise and you get winded too easily, get your heart checked out. A lot of times, that's the only symptom you're going to have with a heart problem, if any. Let's now talk about some common remedies that you want to add to these problems. Let's first talk about autoimmune diseases. You need to add vitamin D3. Anytime you take vitamin D3, always take magnesium, zinc, and K2. That way you'll have less side effects and things work a lot better. If you have autoimmune disease, you want to do this dairy probiotic using Reuteri. It's a dynamite remedy for many things. I will put that link down below. If you have autoimmune of your gut, highly recommend you do the carnivore diet for a few months. and then maybe slowly reintroduce something like sauerkraut. Go on a low-carb diet, cut down your sugars, starches, and seed oils. What's really important is intermittent fasting. I would do 2 meals a day. If you can go to 1 meal a day, that's even better. That's automatically going to reduce your fat on your liver, your visceral fat. There goes inflammation. I do want to mention omega-3 fatty acids. Cod liver oil is the best. And of course, with any inflammation at all, you always want to take vitamin D. I personally have been taking 40, maybe 50,000 IUs of vitamin D every day. And don't forget about the sun. The sun will give you vitamin D for free. Last thing I want to mention, and this is fascinating. I developed a technique. I call it the opposite technique. Anywhere you hurt on the body, you can press on the opposite side and get rid of the pain. It's pretty wild. This is something they don't teach you in school. I will put a couple links down below so you can kind of see. If you have any pain or inflammation anywhere in the body, you might want to try that technique as well, and you'll be very impressed. Thanks for watching, and I will see you in the next video.